Good evening, everyone. I'm Kathleen Welsh-Bohmer. I'm a professor of psychiatry and neurology at Duke University, and I'm also the director of the North Carolina Registry for Brain Health, something I'll talk about in just a moment. For a host of many, many reasons, I wish I was with you all tonight to celebrate this momentous occasion, the 25th anniversary of the Guardian Angel Thrift Store. Over the last quarter of a century, the Guardian Angel Thrift Store has done tremendous work for North Carolina in helping to advance new discoveries in brain health and the prevention of Alzheimer's and related dementias. The Guardian Angel has funded talented new investigators to the field of dementia research. They've given investigators the necessary preliminary data that they need to support continuing lines of investigation. This work has included investigations that looked at novel therapeutic approaches. The ones that come to mind immediately for me are one that looked at cognitive stimulation as an approach, and another one that looked at the abnormal tau aggregations that occur in Alzheimer's disease and looked at changing them through a form of gene editing. Other studies that have been supported by the Guardian Angel include studies of caregivers and patients who are suffering from Alzheimer's disease. And still other studies have really tried to get to the root biology that is propelling these diseases forward at such an accelerating rate. None of this promising work that's been conducted by investigators from across the state of North Carolina would have been possible without the generosity of the Guardian Angel Thrift Store. I know about this very personally while serving as the director of the original Alzheimer's Center here in North Carolina, the Joseph and Kathleen Bryan Alzheimer's Disease Research Center at Duke. I had the great opportunity of receiving funding from the Guardian Angel on at least 3 separate occasions. These generous donations, beginning in the early 2000s, allowed us to set up critical experiments aimed at the genetic mechanisms involved in Alzheimer's disease. This work was so important, and it helped to set the stage for one of the first global Alzheimer's disease prevention trials, the Tomorrow Study, it was called. This was a trial that began in 2013, and it was designed to test the efficacy of a drug, low-dose pioglitazone, a drug that's used to treat diabetes, and was asking the question whether chronic exposure to the low dose of this drug would help to delay the onset of Alzheimer's symptoms in people who were at risk for developing the disease but were not yet suffering from the symptoms of the disease. The Guardian Angel played a key role in this landmark study. Prior to the Tomorrow trial, most drug studies had been done in patients who were symptomatic for Alzheimer's disease. By contrast, the Tomorrow trial was designed to actually test an agent in people who were at risk for the disease but did not have symptoms as of yet. At Duke, we had committed to enroll over 200 cognitively healthy people over a 1-year time period into the study. The challenge in doing this kind of work back in 2013 is where on earth are we going to find a large group of people who would agree to participate in this study? We know where to go when we need to find patients who want to get enrolled in clinical trials. We go to clinics, we go to providers. But where is there a clinic of healthy people with no sign of Alzheimer's disease who would be eager to participate in a study to prevent it? There was no such clinic or ready pool of participants available that could help us seek our enrollment goal of getting people into a prevention trial of Alzheimer's disease. That is, there was no ready available pool until the Guardian Angel Thrift Store gave us funds to start what is now known today as the North Carolina Registry for Brain Health. In 2014, through a very generous donation from the Guardian Angel, we proposed that it would be possible to identify cognitively healthy people. We said we thought we could get over 1,000 enrolled into some type of a data bank or registry, and they would be people indicating they'd be interested in getting involved in research and prevention research, and not just studies of pharmaceutical compounds, but also studies looking at lifestyle interventions and other non-pharmacological approaches that might delay the onset of cognitive problems and dementia. Through the 2014 gift from the Guardian Angel, which was over $100,000, we established a partnership with UNC Chapel Hill, with Wake Forest and Duke, and we set up a registry called the Alzheimer's Disease Prevention Registry. Through this, we were able to achieve our goal of enrolling over 1,200 people into the registry, and from that, we were able to identify 150 people who are interested in participating in the Tomorrow trial. Importantly, we were also very successful in building a registry that represents the broad diversity of North Carolina. Over 35% of the registry identified as being from a minoritized group, primarily as Black or African American. And this was so important to us because this ensured that the research findings coming from the registry would more likely generalize across the population we're serving here in North Carolina. The Guardian Angel Thrift Store supported this Alzheimer's disease prevention registry work, and this became our feasibility data when we later went to the North Carolina State Legislature to propose that we might be able to do something even larger for the entire state of North Carolina to get people involved in research across the state. And this led in 2018 to what we now call the North Carolina Registry for Brain Health. Through that initial funding from the Guardian Angel in 2014, we were awarded state funding in 2018 to establish this more broadly representative registry for brain health to inform the public about the recent advances being made to protect brain health and to involve people across the state of North Carolina to get involved in brain health research, and not just Alzheimer's research, but in healthy brain research. Because of this initial vision of a registry, we now have over 13,500 people participating in the North Carolina Registry for Brain Health. Of these people, over 40% identify from a minoritized community, and at any one time, we're offering over a dozen research studies for people to get involved in, from clinical trials to lifestyle interventions to caregiver studies. The North Carolina Registry involves the community of North Carolina in research, and it also is helping our researchers across institutions in North Carolina get access to participants that more closely mirror our state population. The Guardian Angel Thrift Store helped to set all of this in motion and continues to keep research moving forward towards identifying innovative approaches that will lead to tomorrow's cure. I want to thank you, Guardian Angel, for your leadership and your generosity over the last 25 years for dementia research and brain health research. I wish you the most happy anniversary and a great evening together as we celebrate this incredible milestone event. And I look forward to many more years working together as we advance toward cures for brain disorders. Have a great evening, everyone. And again, happy anniversary, Guardian Angel Thrift Store.